Hi, I'm Norma Perez-Brena, and I'd like to tell you a little bit about a paper I co-authored with my colleagues Kimberly Updegraff, Adriana Umaña-Taylor, Laudan Jahromi, and Amy Guimond. The title of our paper is Co-Parenting Profiles in the Context of Mexican-American Teenage Pregnancy. And we focused on teenage mothers and Mexican-American origin families for two key reasons. First, there is a high likelihood of teenage pregnancy within of Mexican or origin individuals, where the rates of teenage pregnancy are twice the national average. Also, for teenage mothers, 80% of them are likely to live with their parents, and in particular their mothers. These two things are important because as adolescents are transitioning into the role of motherhood at such an early age, they have to rely on the social support systems that they have to help learn about and model good parenting behavior. And because they live with their mothers, they're often co-parenting with those mothers, as well as dealing with normal parent-adolescent relationship dynamics. So, for that reason, we used 167, or data from 167 mothers and their adolescent daughters information, and these adolescents were about 6 months pregnant when we first interviewed them. And we asked them about their parent-adolescent relationship, and then after the adolescents gave birth, about 10 months later, we also interviewed them again to see how they developed co-parenting dynamics between the two. In this case, we used a latent profile analysis approach, and we identified 4 different profiles. A harmonious co-parent approach, where adolescents and the mothers were communicating highly, they were both equally involved, and there was low conflict. And then we had a profile called the harmonious adolescent primary profile, where again the adolescent and the mother were communicated highly. The adolescent was really the primary parent, and there was low conflict. So in this case, the adolescent was really becoming the sole parent for the child, but was receiving support from the mother. The third profile was the conflictual co-parent profile. In this case, there was high communication. Both mothers and the adolescents were equally likely to be involved in the infant's life, and there was high conflict. So in this case, this profile was characterized by adolescents and mothers who are really talking a lot about how to parent this infant, but they're having a lot of struggles deciding or agreeing on how to do it. And our final profile was a conflictual adolescent primary profile. And in this case, there was low communication between the adolescent and the mother. The adolescent was primary in terms of parenting, and there was high conflict. So the mother and the daughter, or the mother and the adolescent, weren't talking much, and the adolescent was taking on the primary role as parent. But whenever the mother and the adolescent were talking about parenting, they were mostly having conflicts. So there might have been a bit of gatekeeping or just disagreement about parenting that might have led to this kind of less involvement from the adult mother. In addition, we looked at some precursors to this co-parenting profile, some parent-adolescent relationship precursors prior to the baby's arrival, and we explored some outcomes in terms of depressive symptoms and parental efficacy after the infant was born. And we do identify that there are certain profiles who are more optimal in terms of their link to better adjustment after the infant is born. Primarily, the harmonious co-parents and harmonious adolescent primary parents were showing more optimal adjustment as compared to the more conflictual profiles. And what this helps us to know as practitioners is that there are some adolescent or parent-adolescent relationship dynamics that could help us identify what may place these dyads at risk for less than optimal co-parenting later on. So prior to the infant's birth, we could potentially work with families to learn how to be good team members and good co-parents so that they don't start developing less than optimal interaction styles later on. Further, as researchers, I think it would be important to continue to study these profiles to see how malleable or stable they are later on. Are these profiles continuing a year or 2, 3 after the infant is born, or are they more malleable? Can we actually work with co-parents and get them to maybe reduce a little bit of conflict, increase communication, and we can put them in a more positive trajectory or more positive profile. This is it for this kind of description of this study. I hope that you will look at the paper itself to get more insights and more details as to the results. And if you have any questions, please feel free to contact me. My name and email is norma.perez-brena@texasstate.edu, and I will respond to any questions promptly. Thank you.